Hi, my name is Kimberly Brown, and this YouTube video is part of a requirement of Module 4, Assignment 4 for a pharmacological class at Aspen University. I'm going to talk about a scenario in our textbook, and then I'll talk about a research question that we had as well. The scenario of a 54-year-old woman was brought into the emergency department where I work. The woman is combative, disoriented, accusing the EMS of trying to steal her purse. Her hand is shaking. She's bleeding from scrapes on her arm and her face. The woman is shouting at the doctors and nurses that she needs a bottle. The woman smells of stale body odor and urine, and her clothes are dirty. Based on her presentation, I would suspect that the woman is suffering from an alcohol use disorder. Alcoholism is also referred to as alcohol use disorder, AUD, according to the American Addiction Center's 2020. AUD can be categorized as mild, moderate, or severe. Each category comes with different symptoms and side effects. According to the American Addiction Center, more than 7% or 17 million adults 18 years and older have an AUD. Some short-term health risks associated with AUD are hypoglycemia, the reduced ability to clot the blood, impaired judgment, decreased perception and coordination. Some of these signs and short-term risk factors could explain why the woman is being combative, disoriented, and stating that she needs a bottle. Some of the long-term health risks with AUDs are liver damage, brain damage, malnutrition, vitamin B1 deficiency, pancreatitis, and broken relationships. This woman might have broken relationships and is now living on the streets, which could explain why her clothing is dirty, she smells of urine, and have a stale body odor. She might be also experiencing a vitamin B1 deficiency and is suffering from Wernicke-Korsakoff syndrome, which would explain her confusion, her delirium, and her combativeness. Other long-term consequences of alcoholism or AUD are arrests, domestic disputes, job losses, and child custody issues. AUD affects every aspect of an individual's life and can lead to premature death. To explain why her hand is shaken, it's most likely due to being hypoglycemic. AUD causes hypoglycemia, which could explain the woman's combativeness, confusion, delirium. Other symptoms of hypoglycemia are irritability, anxiety, nervousness, seizure, and coma. While doing an assessment of the patient, I would order a drug alcohol test to determine if there are any drugs or alcohol in her system. I would order a CBC blood panel to determine if the woman has any infections or is anemic. Order CMP to determine if the woman is dehydrated or have some other electrolyte imbalance. The CMP will also be able to confirm any liver or kidney stress. Looking at the AST and the ALT ratios could confirm liver damage due to alcohol. An elevated serum AST in relation to a serum ALT is an indicator that alcohol has induced organ damage. When the AST and the ALT ratio is greater than 1.5, this is highly suggestive that alcohol is the cause of the patient's liver injury. After the patient is stabilized, I would order a mental health assessment to assess the woman's mental health state. The research question about mental illness and insurance supporting the treatment for mental illness, and is it sufficient? And if not, then what could be done? In 1980, the American Psychiatric Association identified substance use disorder as primarily a mental health disorder. They identified alcoholism as a personality disorder, in the DSM. And this is the Authority for Diagnosing Mental Health Disorders in the United States. The consequence of alcohol abuse or the inability to stop drinking even when there's a desire to stop. Every day, 29 people in the United States die in motor vehicle crashes that involve an alcohol impaired driver. This is a death one every 50 minutes. The annual cost of alcohol related crashes total more than $44 billion. This is probably the motivation behind a national hotline. We have a national hotline that we can call for those that have alcohol, AUD, and if the person doesn't have insurance, they're referred to their state agency. Arizona state funded facilities are free and they pay for in and outpatient treatment as well as pharmacological treatment. The state of Arizona have many state funded treatments and it's for the residents of Arizona. Many of these treatment plans are free based on the financial history of the individual. Some of the facilities are New Safe Haven for men and women, the Potter's House Substance Abuse Center, the USPHS Alcoholism Substance Abuse Program, New Arizona Family Highland, and Banner Health Good Samaritan Medical Center Behavior Health Services. Thank you very much for your attention. This video talked about AUDs as a possible case study for the woman that was brought into the emergency room. And I also talked about mental health disorder and state-funded facilities to treat it. Thank you.